Here we are with the anterior skull, and we're going to find a good amount of markings here, but let's begin first with going from superior to inferior. We don't have the mandible here, but we addressed that in a different video. So let's take a look at the first part. If you kind of just want to put your thumb right here on the skull, that's called the glabella. This little portion, flattened portion of the forehead, that is the glabella. Right next to it, you'll find these kind of prominences. If I kind of see these little bumps, in which you could imagine this is, if I were to say, where's the bump of the forehead? It would be right through here, and you could find these little kind of streaks underneath, specifically even in a male skull, much more than this female skull here. That's what we call the frontal eminences. So the frontal eminences have these larger kind of prominent ridges on somebody's forehead, and those are called the frontal eminences, like presence, that you have an eminence about it. All right, let's go down. What we find is we find a ridge. Now on this model, because it's a female and it's not too developed, it's actually a pretty young skull. You should have these big kind of brow ridges where your eyebrows would be, and that is what we call the superciliary arches. So the superciliary arches are where you would paint your eyebrows, essentially. Just below that is a margin called the superior orbital margin. Orbit referring to the eyeball. I always think of like a Earth orbiting, so that's your eyeball in there. So the eye socket orbit. So if I went in and crossed the margin to jump into the orbit, that is called the superior orbital margin, just like the inferior orbital margin. As I were to come and be like, where's the orbit? Ah, fall right in, okay? Right here is also a hole, and this is what we call the supraorbital foramen. If it's a true hole like this one, you can see this is a true hole. That's called the foramen, supraorbital foramen, just like on both sides, carries a nerve to give sensation to your face. But as you age, you'll lose this and it becomes a notch, and then we just call it the supraorbital notch. If you look inside the eye itself, or the eye socket, you'll find two cracks, and every time I think of cracks, I think of fissure. You know, you make a fissure. I remember going out to Colorado having these big fissures. You jump this crack. Well, this is called the superior orbital fissure, and then this one's the inferior orbital fissure, aptly named because they're inside the orbit. And then you get this huge hole called the optic canal. So you can hopefully see that right there. That's where your optic nerve number 2 comes in. Right here also you'll find a nice little shallow depression or groove. That is the lacrimal fossa. Every time I hear lacrimate, lacrimal, that is to cry. And so whenever you're tear, you'll imagine these guys crying and tearing. Well, this is where your tears will go in and then drain into your nose, and that's why you sniffle when you cry. And so this is a groove out there, and then you can see the lacrimal foramen. You can see this large hole going right into the nasal cavity. So if the shallow depression, of course, is the fossa, the foramen is then the hole. Other than that, you have another hole right here. You could hopefully see this little tiny hole here as well as here. If this is a supraorbital foramen, then this is the infraorbital foramen. Use the words to help you think above the eye socket orbit, hole, supraorbital foramen. Well, what about this one? Infraorbital foramen, because it's below the eye socket, hole. Inside also we find this little sharp kind of peak. That is the anterior nasal spine. And then inside you can kind of see some concha right here. This is the inferior nasal concha, a separate bone. Here's the middle nasal concha, and if I were to try to look way up there, you kind of see some shell-shaped structures of the superior nasal concha. And there's 3 sets of them, 1, 2, 3. You can't really see it. It's hidden behind this little guy here. But you can see 3 different shell-shaped structures in the nose. If you think of Lord of the Rings or Lord of the Flies, you can imagine those guys blue in a concha, a shell-shaped structure, inferior nasal concha, middle nasal concha, and then way up there behind what you can't see is the superior nasal concha. You see the nasal septum, made by the ethmoid bone, and then the vomer, which is most of the inferior aspect of this. And then, of course, then you get the alveolar margins, the alveolar processes, which are these ridges here, and the margin is what branches before you get into teeth. All right, so let's review. Here's the anterior surface. We got the glabella with the frontal eminences kind of like radiating off. If you were to kind of go like this, notice I had to change my direction of my stick. This area right here going up, and then you get this little ball. That's the frontal eminences. You get the supraciliary arches, which is where you paint your eyebrows. Not too prominent on this one, but they are there. And then here's the supraorbital foramen, infraorbital foramen with the superior orbital margin, inferior orbital margin with the superior orbital fissure, inferior orbital fissure, optic canal. Here's the nasal septum, half of it's the vomer, or the inferior 1/3 is the vomer, superior 2/3 of the ethmoid, and then you get the shell-shaped structures of the inferior middle nasal concha with a nice spine here. That's the anterior nasal spine, and then here is the alveolar margin with the alveolar processes kind of hanging off.